A new report came out today and I had to run and share it here as quickly as I could because it is extremely well written. It's written in plain English and it ties together so many different points that I've been trying to cover on this channel. It's called Long COVID in Aotearoa, New Zealand, Risk Assessment and Preventive Action Urgently Needed. It's by the Public Health Communications Center in Aotearoa.
Aotearoa.
That's how to pronounce it better. This is a group based out of University of Otago, the oldest university in New Zealand, and I'm just going to cover the summaries of the report. I probably could do a 20-part video just covering individual paragraphs. Here's the summary of the report. COVID-19 can cause longer-term changes in health, collectively known as long COVID. With only 4 years of follow-up time to observe this evolving new virus, we cannot yet see the full picture of long COVID, but its impacts are already substantial and measurable in individuals, sectors, and societies. Evidence consistently shows that long COVID is common, affects all ages, and frequently results in prolonged illness that can be disabling. It occurs with first infections and reinfections and follows all virus variants. There is currently no cure, making prevention critical. They urgently recommend the New Zealand government identify a proportionate response by conducting a comprehensive long COVID risk assessment to individual, sector, society, rapidly reduce infection and reinfection rates by ensuring public settings are safer to access, and expanding COVID-19 vaccine eligibility and uptake. And here are some of their key findings. Changes in health status following SARS-CoV-2 infection are common and can occur at any age. Symptoms are frequently experienced for months or years and can increase over time. Several recent and well-designed cohort studies have reported central estimates ranging from 4 to 14% for ongoing symptoms per infection. Like my last several videos on long COVID, consistently we see rates of somewhere between 5 to 20% of long COVID. This report is finding 4 to 14. They go on, long COVID includes a full spectrum of severity from hidden effects through mild and transient symptoms that come and go to life-changing and life-limiting conditions such as heart attacks and strokes, diabetes, myalgic encephalomyelitis / chronic fatigue syndrome, MECFS, and neurological disorders. Commonly experienced symptoms such as fatigue and cognitive dysfunction have a high impact on quality of life. Both SARS-CoV-2 infection and long COVID are undercounted in children. There is no cure for long COVID and management options are currently extremely limited. Vaccines help to reduce the risk of long COVID, but it's mostly focused on older adults to protect against acute disease, and it's not focusing on this long-term impact for most of society. Future health impacts can be expected in addition to the effects that are already known and observed. Some people who are currently well post-COVID, I think that means people who feel okay, are already expressing biomarkers on tests of risk for cardiovascular disease, neurodegenerative disorders, a range of autoimmune diseases, and cancers, conditions that typically have latency periods lasting years or decades. So let's break down what that means real quick. There are people that feel okay after a COVID infection, but they have biomarkers that can be found in tests of increased risks for heart issues and circulatory issues. Neurodegenerative is your neurons in your brain degenerating. Autoimmune diseases where your immune system is attacking your own body or your own cells, and cancers. And usually these things take years or decades to develop, but we are seeing increased biomarkers within a few years with COVID. And this one's tragic. Early life exposure to infections can have lasting impacts on developing tissues and organ systems. Already, several adverse effects of perinatal COVID-19 exposure have been described. And I had to look this up. Perinatal is the weeks before and after birth. Pre-pandemic evidence shows the adverse effects of inflammation on the developing brains of children and adolescents, which is concerning because neurological involvement is common even in mild SARS-CoV-2 infection. And let's remember that inflammation is one of the hallmarks of COVID. It makes your immune system very wonky and into overdrive, and it causes inflammation in a lot of places, which are connected, again, to all these things up here: cardiovascular disease, neurodegeneration, autoimmune issues, and cancer. Now, if the risks of long COVID are somewhere between 4% to 14% each infection, and people are getting this repeatedly, that's huge impacts on society, and that's what this section covers. It says, society, sector, and workforce effects of long COVID are costly and disruptive, and they worsen existing inequities. Long COVID is associated with increased healthcare use, productivity loss, and workforce impacts, with implications for New Zealand workforces that experience high incidence of COVID-19, such as educators, healthcare workers, and prison workers. I'd also want to highlight people in prison who can't control their exposures and are probably getting wrecked by this, and it's really, really, really horrible. The frequency of often undiagnosed cognitive impairment after a mild infection indicates a need for risk assessment of impacts on occupational safety and performance. Occupations of particular concern because of safety implications include healthcare workers, airline pilots, electricians, truck drivers, and first responders. And again, I've talked about that on this channel. We have lots of people with brain fog, which is brain damage, and we are relying on them to complete complex roles. And I'm not trying to stigmatize brain damage in any way. I just think if you have brain damage or issues with memory, focus, something like air traffic control is not the best place for you the way we currently do it. So again, we have to design society around large-scale changes to people's brains and take it into account is my bigger point. So many different issues here. One, their brains may not be performing as well as they used to in terms of memory, in terms of attention, emotional regulation, all kinds of different things in stressful situations. And two, people are just sick more often than they used to be because of the immune dysregulation impacts. So you have situations where there are a few people that know how a really complex system work, or people that play a key role in those systems, and they may be out sick, they may need to retire due to long COVID. For example, at a time where we're having crises around the world in Gaza, Sudan, DRC, the head of UN emergency relief is stepping down due to long COVID. That's exactly an example of what I'm talking about. COVID-19 is a syndemic condition. It causes chronic disease, and chronic disease itself increases susceptibility to COVID-19. A vicious circle for some, or for many. There are profound health equity implications for Maori and Pacific peoples and people with disabilities or underlying chronic conditions. And remember that COVID can give you disabilities or underlying chronic conditions, which is why all this, like in their original picture, is a domino effect. This is what I've been worried about for years. It's not just the acute infection. It's all these dominoes that fall behind it. Notice we're 8 minutes in, and this is only the summary. That's how good this report is. There are appendices that are also really, really important that I may cover in other videos. But anyway, because of rapid viral evolution, COVID-19 waves are not showing a consistent pattern of improvement over time. In the US, what we're actually seeing is the baseline levels of COVID are just rising and rising in between the waves. Without intervention to reduce cases, the prevalence of long COVID is more likely to increase than decrease. Absolutely. Ongoing exposure to new, highly transmissible variants, in combination with the high incidence of long COVID per infection and the long duration of symptoms, drives up the population prevalence. Evolutionary biologists note that the future variant scenarios include the possibility of both higher and lower disease severity, with unpredictable impacts on long COVID risk. Meaning it's not just going to get more mild over time. It depends on the variant. It depends on a lot of factors. This viruses get more mild over time is not actually true. You can read articles on it. Lack of seasonality increases risk exposure and reduces recovery time between infections. COVID is not seasonal like the flu. With the flu, you can see it rises in the late fall, goes through about February in the US, but it is near zero the rest of the year. Whereas COVID has these waves, it goes down, but it doesn't go down to zero. It's just around most of the time. A high proportion of the New Zealand population has had COVID at least once, and exposure to reinfection is continuing. Each infection is a throw of the dice, or as I call it, Russian roulette. At 4 years into the pandemic, we are still well within the latency period of many chronic conditions. Biomarker evidence is a reminder that past COVID variants can still cause future long COVID cases, meaning your infection in 2020, 2021, 2022 can still manifest years later in other conditions that we highlighted already. So link in bio, really, really crucial report. This is even just the first fourth of it. It's really, really helpful.